Hi, I'm Mark Johnson, your educator at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. This innovative AI-powered question bank adjusts to your performance and provides audio rationales for a unique and efficient review process. For full access, please refer to the description box below. Have your notebook ready and follow along as we sharpen your critical thinking skills. Let's get started with question 1.
A 15-year-old adolescent is brought to the clinic for a routine checkup. The nurse notes a blood pressure of 145 by 92 millimeters of mercury. The adolescent is in the 95th percentile for weight and reports a sedentary lifestyle with frequent consumption of fast food. The family has a history of hypertension. Which health promotion strategy should the nurse prioritize to address the adolescent's condition? Encourage participation in a school sports team. Suggest a low-sodium diet. Recommend a weight loss program. Advise on stress management techniques. The correct answer is A. Rationale. Correct answer, the first option. Encouraging participation in a school sports team helps increase physical activity, which is crucial for managing hypertension in adolescents. Regular exercise can help reduce blood pressure and improve cardiovascular health. Given the adolescent's sedentary lifestyle and high blood pressure, promoting physical activity is a key intervention. This approach also aligns with growth and development needs by fostering social interaction and physical fitness. Distractor rationales. B. The second option. While a low-sodium diet is beneficial, increasing physical activity is more impactful for an adolescent with a sedentary lifestyle. C. The third option. A weight loss program may be beneficial, but promoting physical activity is a more immediate and developmentally appropriate intervention. D. The fourth option. Stress management is important, but the primary focus should be on increasing physical activity to directly address hypertension. Clinical tip. Incorporating physical activity into daily routines is essential for managing hypertension, especially in adolescents, as it supports overall growth and development. A 62-year-old client with renal cell carcinoma is recovering from a nephrectomy. Which nursing intervention is most important to prevent post-operative complications related to basic care needs? Here are the options. Option 1. Encourage deep breathing exercises every 2 hours. Option 2. Provide a high-protein diet to promote healing. Option 3. Monitor the client's blood pressure every 4 hours. Option 4. Assist the client with ambulation 3 times daily. The correct answer is A. Rationale. Correct answer, the first option. Encouraging deep breathing exercises every 2 hours is critical to prevent atelectasis and pneumonia, which are common postoperative complications. Deep breathing and coughing help to expand the lungs, clear secretions, and maintain adequate oxygenation. This intervention is especially important in clients who have undergone abdominal or thoracic surgery due to the risk of respiratory complications. Postoperative deep breathing reduces the likelihood of pulmonary issues, thereby facilitating better recovery. Distractor rationales. B. The second option. While a high-protein diet is beneficial for wound healing, it is not the primary intervention to prevent immediate postoperative complications. C. The third option. Monitoring blood pressure is important, but it does not directly address preventing postoperative complications related to basic care needs. D. The fourth option. Assisting with ambulation is important for preventing complications like deep vein thrombosis, but it is not as immediately critical as preventing respiratory issues. Clinical tip. Encourage postoperative clients to use an incentive spirometer regularly to improve lung function and prevent respiratory complications. A 55-year-old client with a history of mitral stenosis is admitted to the hospital with worsening dyspnea and fatigue. The nurse reviews the client's medication list. Which medication should the nurse anticipate administering to manage the client's symptoms? Here are the options. Option 1, aspirin. Option 2, furosemide. Option 3, metoprolol. Option 4, digoxin. The correct answer is B. Rationale. Correct answer, the second option. Furosemide, a loop diuretic, is often used to manage symptoms of fluid overload in clients with mitral stenosis. It helps reduce pulmonary congestion and peripheral edema by promoting diuresis, thereby alleviating dyspnea and fatigue. This medication is effective in decreasing the volume overload on the heart, which is a common issue in mitral stenosis. Administering furosemide aligns with the pharmacological management of heart failure symptoms associated with valvular heart diseases. Distractor rationales. A. The first option, aspirin, is not primarily used to manage symptoms of mitral stenosis. It is more relevant for preventing thromboembolic events. C. The third option, metoprolol, is a beta blocker that can help control heart rate but does not directly address fluid overload. D. The fourth option, digoxin, may be used to improve cardiac output but is not the first-line treatment for fluid overload symptoms. Clinical tip: in patients with valvular heart disease, diuretics are crucial for managing fluid overload and reducing symptoms of congestion. A 25-year-old client presents to the emergency department with a sprained ankle sustained while playing basketball. The ankle is swollen, bruised, and the client rates the pain as 7 out of 10. Vital signs are stable. Which of the following is the most appropriate initial nursing intervention? Here are the options. Option 1, apply a warm compress to the affected area. Option 2, elevate the ankle above heart level. Option 3, encourage the client to walk to reduce stiffness. Option 4, administer oral analgesics immediately. The correct answer is B. Rationale. Correct answer, the second option. Elevating the ankle above heart level is the most appropriate initial intervention to reduce swelling and promote venous return. This action helps minimize edema and pain associated with the sprain. While pain management is important, reducing swelling is a priority in the acute phase of a sprain. Warm compresses are contraindicated initially as they can increase swelling. Distractor rationales. A. The first option, applying a warm compress can increase swelling and is not recommended in the acute phase of a sprain. C. The third option, encouraging the client to walk can exacerbate the injury and increase pain and swelling. D. The fourth option, while pain management is important, reducing swelling through elevation is a priority in the acute phase. Clinical tip: remember the RICE method for sprains: rest, ice, compression, and elevation to manage acute injuries effectively. A 10-year-old child with a history of rheumatic heart disease is attending a routine checkup. The nurse is educating the child's parents on health promotion strategies to support their child's growth and development. Which recommendation should the nurse prioritize to prevent complications associated with rheumatic heart disease? Here are the options. Option 1. Ensure the child receives regular dental checkups. Option 2. Encourage participation in competitive sports. Option 3. Administer prophylactic antibiotics as prescribed. Option 4. Increase dietary sodium to support growth. The correct answer is C. Rationale. Correct answer, the third option. Administering prophylactic antibiotics as prescribed is crucial in preventing recurrent streptococcal infections, which can exacerbate rheumatic heart disease. This preventive measure is essential to avoid further damage to the heart valves, ensuring the child's growth and development are not compromised by additional cardiac complications. Regular antibiotic prophylaxis is a key component of managing rheumatic heart disease in children, as it helps maintain cardiac health and supports overall well-being. Distractor rationales. A. The first option. While regular dental checkups are important for overall health, they do not directly prevent complications of rheumatic heart disease. B. The second option. Encouraging participation in competitive sports may not be advisable due to potential cardiac strain associated with rheumatic heart disease. D. The fourth option. Increasing dietary sodium is not recommended as it can lead to fluid retention and exacerbate cardiac issues. Clinical tip. For children with rheumatic heart disease, consistent adherence to prescribed prophylactic antibiotics is vital to prevent recurrent infections and protect heart health. A 45-year-old female client in the emergency department presents with acute abdominal pain, nausea, and a heart rate of 115 BPM. She has a history of gallstones. The nurse notes tenderness in the right upper quadrant upon palpation. Which initial action should the nurse take? Here are the options. Option 1. Request an abdominal ultrasound. Option 2. Administer pain medication as prescribed. Option 3. Insert a nasogastric tube. Option 4. Encourage the client to walk. The correct answer is B. Rationale. Correct answer, the second option. Administering pain medication as prescribed addresses the client's immediate discomfort, which is a priority in managing acute pain. Analgesia can prevent complications associated with uncontrolled pain, such as increased heart rate and hypertension. Distractor rationales. A. The first option. This option is incorrect because although an ultrasound may be necessary, managing acute pain takes precedence. C. The third option. This option is incorrect because a nasogastric tube is not indicated in this situation without evidence of bowel obstruction or severe vomiting. D. The fourth option. Encouraging the client to walk is incorrect as it might exacerbate pain and is not a priority intervention. Clinical tip. In acute abdominal pain, always prioritize pain management and assess for signs of complications like peritonitis or shock. A patient with borderline personality disorder, recently adjusted on medication, is 48 hours post-telemetry discontinuation. They exhibit fluctuating hemodynamic states with BP 110/70 mm of mercury, HR 98 beats per minute, and mixed venous oxygen saturation of 65%. The nurse should administer placeholder 1 and ensure placeholder 2 for optimal care. The correct answer is placeholder 1, administer oxygen therapy, placeholder 2, continuous cardiac monitoring. Rationale. Correct answers: administer oxygen therapy and continuous cardiac monitoring. Step-by-step clinical reasoning. 1. Recognize the low mixed venous oxygen saturation as a sign of potential hypoxemia requiring immediate intervention. 2. Administering oxygen therapy directly addresses the airway and breathing components of the ABC priority framework, ensuring adequate tissue oxygenation. 3. Continuous cardiac monitoring is essential to detect any arrhythmias or further hemodynamic instability, providing real-time data for immediate intervention. 4. Evidence-based guidelines prioritize airway and breathing stabilization in acute scenarios. American Heart Association, 2023. 5. This combination optimally addresses both physiological needs and prevents rapid deterioration by ensuring adequate oxygen delivery and monitoring. American Heart Association, 2023. Distractor rationales, clinical tip, clinical pearl. In acute scenarios with potential hypoxemia, prioritize oxygen therapy to stabilize airway and breathing before addressing other concerns. Continuous monitoring ensures rapid detection and intervention for any cardiac changes. A 32-year-old pregnant client in her third trimester is admitted to the hospital due to preterm labor. During her stay, The nurse notices that the client's intravenous IV line is close to being empty. The client expresses concern about the possibility of falling due to the frequent need to use the restroom. What is the most appropriate nursing action to ensure the client's safety in this situation? Here are the options. Option 1. Ensure the call bell is within the client's reach and instruct her to call for assistance before getting up. Option 2. Encourage the client to use the bedside commode without assistance to promote independence. Option 3. Allow the IV line to run dry and then replace it to avoid frequent trips to the restroom. Option 4. Position the client closer to the restroom to minimize walking distance when she needs to use it. The correct answer is A. Rationale is the first option. Ensuring the call bell is within the client's reach and instructing her to call for assistance before getting up prioritizes the client's safety by preventing potential falls, especially given her altered center of gravity in the third trimester. This action aligns with infection control and the safe care environment by maintaining the integrity of the IV line and ensuring the client does not ambulate unassisted, which could lead to falls. Nurses must remain vigilant and proactively address potential hazards in the environment. Distractor rationales. B. The second option. Encouraging independence in this scenario neglects the client's safety and increases the risk of a fall, which is a significant concern in the third trimester. C. The third option. Allowing the IV line to run dry could lead to complications such as air embolism and compromise the client's hydration and medication regimen. D. The fourth option. While minimizing walking distance to the restroom may seem helpful, it does not replace the need for assistance and supervision to prevent falls. Clinical tip. Pregnant clients, especially in the third trimester, have an increased risk of falls due to changes in balance. Always ensure they have access to help and understand the importance of waiting for assistance. A 65-year-old client with a history of peripheral arterial disease, PAD, is attending a community health fair. The nurse is providing education on lifestyle modifications to prevent disease progression. Which recommendation should the nurse prioritize for this client? Here are the options. Option 1. Engage in daily high-intensity interval training. Option 2. Increase dietary intake of saturated fats. Option 3. Quit smoking and avoid exposure to tobacco smoke. Option 4. Limit fluid intake to prevent edema. The correct answer is C. Rationale, correct answer, the third option. Quitting smoking and avoiding exposure to tobacco smoke is crucial for clients with peripheral arterial disease, PAD. Smoking is a significant risk factor for PAD, as it contributes to atherosclerosis and impairs circulation. By quitting smoking, the client can slow the progression of PAD and reduce the risk of cardiovascular events. This lifestyle modification is one of the most effective strategies for managing PAD and improving overall vascular health. Distractor rationales. A. The first option. High-intensity interval training may be too strenuous for clients with PAD and could exacerbate symptoms like claudication. B. The second option. Increasing dietary intake of saturated fats can worsen atherosclerosis, which is detrimental for PAD management. D. The fourth option. Limiting fluid intake is not recommended for PAD and does not address the underlying vascular issues. Clinical tip. For clients with PAD, encourage smoking cessation as it significantly improves circulation and reduces the risk of complications. Support groups and nicotine replacement therapies can be beneficial. A 2-year-old child is brought to the emergency department with croup, presenting with a barking cough and stridor. The parents are visibly distressed and anxious about their child's condition. The healthcare provider has ordered a dose of nebulized epinephrine. What is the nurse's priority psychosocial intervention for the parents? Here are the options. Option 1. Explain the mechanism of action of nebulized epinephrine. Option 2. Reassure the parents that the treatment is effective and their child is in good hands. Option 3. Instruct the parents to remain calm to avoid distressing the child further. Option 4. Provide detailed information about the signs and symptoms of croup. The correct answer is B. Rationale. Correct answer, the second option. Reassuring the parents that the treatment is effective and their child is in good hands is the priority psychosocial intervention. This approach helps alleviate parental anxiety and fosters trust in the healthcare team. While education and instructions are important, addressing the parents' immediate emotional distress is crucial in a crisis situation. Distractor rationales. A. The first option. Explaining the mechanism of action may not alleviate immediate anxiety. C. The third option. Instructing parents to remain calm without addressing their concerns may not be effective. D. The fourth option. Providing information about croup is important, but secondary to addressing immediate emotional needs. Clinical tip. In emergency situations, providing reassurance and emotional support to family members is as important as the medical care provided to the patient. A 68-year-old female client with a history of urinary incontinence has been admitted to a long-term care facility. She appears withdrawn and avoids participating in social activities. The nursing staff notices that she becomes anxious when discussing her condition. Which nursing intervention should be prioritized to address her psychosocial needs? Here are the options. Option 1. Encourage the client to join group activities to improve social interaction. Option 2. Provide reassurance and discuss coping strategies for managing incontinence. Option 3. Refer the client to a mental health professional for anxiety management. Option 4. Implement a toileting schedule to reduce episodes of incontinence. The correct answer is B. Rationale. Correct answer, the second option. Providing reassurance and discussing coping strategies for managing incontinence addresses the client's anxiety and promotes her psychosocial well-being. This intervention helps the client feel more in control of her condition, reducing feelings of embarrassment and withdrawal. It is essential to acknowledge the emotional impact of urinary incontinence and provide support to enhance the client's quality of life. By focusing on coping strategies, the nurse can empower the client to manage her condition more effectively. Distractor rationales. A. The first option. While encouraging social interaction is beneficial, it does not directly address the client's anxiety related to incontinence. C. The third option. Referring to a mental health professional may be necessary, but initially, the nurse should provide direct support and coping strategies. D. The fourth option. Implementing a toileting schedule is a practical intervention for incontinence, but does not address the client's psychosocial needs. Clinical tip. When addressing psychosocial needs, consider the emotional impact of physical conditions and provide holistic support that includes coping strategies and reassurance. A 34-year-old female client is diagnosed with bacterial vaginosis and prescribed metronidazole. During a follow-up visit, she reports experiencing a metallic taste and mild nausea. What is the most appropriate nursing action regarding her pharmacological management? Here are the options. Option 1. Advise the client to discontinue the medication immediately. Option 2. Instruct the client to take the medication with food to reduce nausea. Option 3. Suggest the client switch to an over-the-counter probiotic supplement. Option 4. Encourage the client to increase fluid intake to flush out the medication. The correct answer is B. Rationale. Correct answer, the second option. Instructing the client to take metronidazole with food can help alleviate gastrointestinal side effects such as nausea. This approach supports adherence to the prescribed treatment regimen by minimizing discomfort. The metallic taste is a common side effect and does not warrant discontinuation of the medication. Distractor rationales. A. The first option, discontinuing the medication is not advised as the side effects are manageable and the treatment is necessary. C. The third option, probiotics may support gut health but do not replace the need for antibiotic treatment. D. The fourth option, while increasing fluid intake is generally beneficial, it does not specifically address the side effects of metronidazole. Clinical tip: taking metronidazole with meals can help reduce nausea, a common side effect, and improve medication adherence. A client reports severe abdominal pain and vomiting. What is the nurse's priority action? Here are the options. Option 1, notify the healthcare provider. Option 2, administer pain medication. Option 3, assess bowel sounds. Option 4, provide oral hydration. The correct answer is 1. Rationale. Correct answer 1. Immediate notification of the healthcare provider is critical because a volvulus and suspected bowel obstruction can rapidly lead to bowel ischemia and perforation, constituting a medical emergency. Prompt surgical intervention may be required to relieve the obstruction and prevent complications. This prioritizes patient safety by addressing the root cause rather than just symptoms. Aligning with the nurse's role in rapid assessment and escalation. Distractor rationales. 2. Administering pain medication addresses symptoms but delays critical intervention for the underlying obstruction. 3. Encouraging ambulation is inappropriate as it might worsen the volvulus and increase risk for bowel perforation. 4. Oral hydration is contraindicated in suspected bowel obstruction and could exacerbate distension and vomiting. Clinical tip: in cases of suspected bowel obstruction, always prioritize interventions that address the underlying cause over symptom management. A 28-year-old pregnant client with a diagnosis of hyperemesis gravidarum is admitted to the hospital due to severe dehydration. The nurse is preparing to initiate intravenous IV therapy. Which of the following actions should the nurse prioritize to ensure safe and effective care when starting the IV infusion? Here are the options. Option 1. Select a vein in the client's dominant hand to enhance comfort. Option 2. Use an 18-gauge IV catheter for rapid fluid administration. Option 3. Verify the identity of the client with 2 identifiers before starting the IV. Option 4. Initiate the IV in the foot to preserve the veins in the arms for future use. The correct answer is C. Rationale. Correct answer, the third option. Verifying the identity of the client with 2 identifiers before starting the IV is a critical safety measure to prevent errors and ensure that the correct patient is receiving the correct treatment. This aligns with the standards of the Joint Commission's National Patient Safety Goals. Proper identification helps avoid medical errors, which are a significant aspect of patient safety in healthcare settings. Ensuring the right patient receives treatment is foundational to providing safe and effective care, particularly in a hospital setting where multiple patients may be receiving IV therapy. Distractor rationales. A. The first option. Selecting a vein in the client's dominant hand could impede mobility and comfort, and it's not a priority over patient identification. B. The second option. Using an 18-gauge IV catheter is unnecessary and may cause unnecessary discomfort. It is not required for all IV therapies, especially when managing dehydration. D. The fourth option. Initiating an IV in the foot is not standard practice and could increase the risk of complications. It does not prioritize patient safety or comfort. Clinical tip: always use 2 patient identifiers before any procedure or treatment to ensure correct patient identification and enhance safety. A 10-year-old child with newly diagnosed acute lymphoblastic leukemia, ALL, is undergoing chemotherapy. the parents express concern about their child's growth and development during treatment. Which nursing intervention is most appropriate to support the child's growth and development during this time? Here are the options. Option 1. Encourage participation in age-appropriate activities when energy levels permit. Option 2. Limit physical activity to prevent fatigue and conserve energy. Option 3. Focus solely on nutritional intake to support physical growth. Option 4. Prioritize academic tutoring to prevent educational delays. The correct answer is A. Rationale. Correct answer, the first option. Encouraging participation in age-appropriate activities supports the child's psychosocial development and provides a sense of normalcy. Engaging in activities when energy levels allow can help maintain social interactions and developmental milestones, which are crucial during prolonged treatment periods. Distractor rationales. B. The second option. Limiting physical activity excessively can hinder social development and contribute to feelings of isolation. C. The third option. While nutrition is important, focusing solely on it neglects other aspects of development, such as social and emotional growth. D. The fourth option. Academic tutoring is beneficial, but prioritizing it over social interactions can impede overall developmental progress. Clinical tip. Incorporate play and social activities into the care plan for pediatric patients to support holistic growth and development, even during illness. A 36-week pregnant client with gestational hypertension presents with proteinuria, oliguria, and BP of 176, 112 mm per mercury. 4 hours post-hydralazine. Creatinine rose to 1.8 mg per deciliter from 1.3 mg per deciliter. Her anxious husband frequently checks on her. Which task may be safely delegated to a UAP? Here are the options. Option 1. Remeasure blood pressure every 30 minutes. Option 2. Adjust oxygen flow rate based on saturation levels. Option 3. Interpret urine output trends and report abnormalities. Option 4. Provide emotional support to the client's husband. The correct answer is 4. Rationale. Correct answer. 4. Step-by-step clinical reasoning. 1. Recognize the signs of preeclampsia, gestational hypertension, proteinuria, and rising creatinine. 2. Emotional support is a non-clinical task that can be safely delegated to a UAP, freeing the RN to focus on clinical priorities. 3. Providing emotional support helps reduce anxiety, which can indirectly benefit the patient's condition. 4. Delegating this task aligns with the American Nurses Association's guidelines on delegation, emphasizing safety and appropriate task assignment. American Nurses Association, 2023. 5. This approach ensures the RN can concentrate on monitoring and managing the patient's critical physiological needs. Distractor rationales. 1. Remeasuring blood pressure requires clinical judgment to interpret trends and potential interventions, which should be performed by a licensed nurse to ensure patient safety. American Nurses Association, 2023. 2. Adjusting oxygen flow requires clinical assessment skills to evaluate saturation levels and potential respiratory complications. Unsuitable for UAPs without RN oversight. Respiratory Care Standards, 2023. 3. Interpreting urine output trends involves understanding complex renal implications of gestational hypertension, necessitating RN expertise. UAPs lack the training to interpret such data for clinical decision-making. Nephrology and Maternity Care Guidelines, 2023. Clinical tip. Clinical Pearl. In scenarios involving gestational hypertension, prioritize tasks that can be safely delegated based on the UAP's scope of practice and focus RN efforts on direct patient care and complex clinical decision-making. A 45-year-old client with confirmed COVID-19 is admitted to the hospital. The nurse is preparing to enter the client's room. Which infection control measure is most important to prevent the spread of the virus? Here are the options. Option 1. Perform hand hygiene before and after patient contact. Option 2. Wear a surgical mask while in the room. Option 3. Use a face shield in addition to a mask. Option 4. Apply a gown and gloves before entering the room. The correct answer is A. Rationale. Correct answer, the first option. Performing hand hygiene before and after patient contact is the most important infection control measure to prevent the spread of COVID-19. Hand hygiene is the cornerstone of infection prevention and is critical in breaking the chain of transmission. While wearing a mask, face shield, and gown and gloves are important, hand hygiene is universally applicable and essential in all settings. Distractor rationales. B. The second option. A surgical mask is necessary, but hand hygiene is more universally effective in preventing transmission. C. The third option. A face shield provides additional protection but does not replace the fundamental need for hand hygiene. D. The fourth option. Gown and gloves are important for contact precautions, but hand hygiene remains the primary defense. Clinical tip. Hand hygiene is the single most effective way to prevent the spread of infections in healthcare settings. Always prioritize it in infection control protocols. A 65-year-old patient with a history of hypocalcemia is admitted to the hospital for observation. The nurse notes that the patient is at risk for falls due to muscle spasms and tremors. What is the priority nursing intervention to ensure the patient's safety in this situation? Here are the options. Option 1. A. Administering calcium supplements immediately. Option 2. B. Implementing seizure precautions in the room. Option 3. C. Providing a bedside commode to reduce walking distance. Option 4. D. Applying fall risk bands and ensuring the call light is within reach. The correct answer is D. Rationale. Correct answer, the fourth option. Applying fall risk bands and ensuring the call light is within reach is essential for patient safety. This intervention directly addresses the risk of falls by alerting all staff to the patient's fall risk and providing a means for the patient to call for help if needed. While administering calcium can help address the underlying hypocalcemia, it is not an immediate safety intervention. Ensuring that a patient who is prone to falls due to muscle spasms has immediate access to assistance is a priority. Distractor rationales. A. The first option. While administering calcium supplements is important for treating hypocalcemia, it is not the immediate priority for ensuring safety from falls. B. The second option. Seizure precautions are not specifically required unless the patient has a seizure disorder. C. The third option. A bedside commode may help, but ensuring the patient can call for help at any time addresses the broader safety concern. Clinical tip. Always ensure patients at risk of falls have safety measures in place, like fall risk bands, non-slip footwear, and easy access to call lights or help. A client reports chronic pain and fatigue. Which tool assesses their impact on daily life? Here are the options. Option 1. Visual Analog Scale. Option 2. Fibromyalgia Impact Questionnaire. Option 3. Beck Depression Inventory. Option 4. Mini Mental State Examination. The correct answer is 2. Rationale. Correct answer 2. The Fibromyalgia Impact Questionnaire, FIQ, is specifically designed to assess the impact of fibromyalgia on a client's life. It evaluates areas such as physical functioning, work status, depression, anxiety, sleep, pain, stiffness, fatigue, and well-being. This tool provides a comprehensive view of how fibromyalgia affects daily living, guiding interventions to improve quality of life. Distractor rationales. 1. The visual analog scale is useful for assessing pain intensity, but does not cover the broader impact of fibromyalgia symptoms. 3. The Beck Depression Inventory identifies depression, but does not specifically address fibromyalgia symptoms. 4. The Mini Mental State Examination evaluates cognitive impairment and is not relevant to fibromyalgia assessment. Clinical tip: in clients with fibromyalgia, consider assessing for co-occurring conditions like depression and anxiety, which can exacerbate symptoms. A 32-year-old pregnant client is admitted to the hospital with a diagnosis of placenta previa at 28 weeks of gestation. She expresses significant anxiety about the potential for preterm delivery and the health of her baby. Which nursing intervention is most appropriate to address the client's psychosocial needs? Here are the options. Option 1. Provide detailed medical information about placenta previa and potential outcomes. Option 2. Encourage the client to express her feelings and concerns about the situation. Option 3. Suggest the client join a prenatal yoga class to reduce stress. Option 4. Advise the client to avoid thinking about the situation to reduce anxiety. The correct answer is B. Rationale. Correct answer, the second option. Encouraging the client to express her feelings and concerns is a therapeutic communication technique that helps address her anxiety. This approach allows the client to verbalize her fears, which can be the first step in managing anxiety. It also helps the nurse assess the client's emotional state and provide appropriate support. By actively listening, the nurse can offer reassurance and validate the client's feelings, which is crucial in psychosocial care. Distractor rationales. A. The first option, providing detailed medical information, may overwhelm the client and increase anxiety rather than alleviate it. C. The third option, while prenatal yoga can be beneficial, it does not directly address the client's immediate emotional needs in the hospital setting. D. The fourth option, advising the client to avoid thinking about the situation, is not a healthy coping strategy and may lead to increased anxiety. Clinical tip: in situations involving anxiety, use active listening and therapeutic communication to help clients express their feelings. This can facilitate emotional support and anxiety reduction. A 16-year-old adolescent with a history of ventricular fibrillation is being evaluated for a sports physical. The client is eager to participate in competitive sports. Which of the following should the nurse prioritize when discussing growth and development considerations with the client and their family? Here are the options. Option 1. Encourage participation in all sports to promote social development. Option 2. Discuss the importance of avoiding high-intensity sports to prevent cardiac events. Option 3. Focus on the client's desire for independence and autonomy. Option 4. Emphasize the need for regular cardiac monitoring only during sports activities. The correct answer is B. Rationale. Correct answer, the second option. Discussing the importance of avoiding high-intensity sports is crucial for adolescents with a history of ventricular fibrillation to prevent potentially life-threatening cardiac events. While social development and independence are important aspects of adolescent growth, safety and health take precedence in this context. High-intensity sports can trigger arrhythmias, and the nurse should guide the family in choosing safer activities. Distractor rationales. A. The first option, encouraging participation in all sports disregards the potential risks associated with high-intensity activities for this client. C. The third option. While independence is important, it should not compromise the client's health and safety. D. The fourth option. Regular cardiac monitoring is important, but should not be limited to sports activities alone. Clinical tip. When advising adolescents with cardiac conditions, balance their developmental needs with safety considerations. Encourage activities that promote health without undue risk. A 16-year-old male has been diagnosed with reactive arthritis following a recent gastrointestinal infection. He is concerned about how this condition might affect his growth and development. Which health promotion strategy should the nurse prioritize to support his developmental needs? Here are the options. Option 1. Encourage participation in physical therapy to maintain joint function. Option 2. Advise on a high-calcium diet to support bone growth. Option 3. Discuss the importance of maintaining social activities with peers. Option 4. Recommend regular ophthalmologic exams to monitor for uveitis. The correct answer is C. Rationale. Correct answer, the third option. Maintaining social activities with peers is crucial for adolescents, who are in a critical stage of psychosocial development focused on identity and peer relationships. Reactive arthritis can be socially isolating due to its symptoms, so encouraging social engagement helps support emotional well-being and normal developmental progress. While physical therapy and dietary considerations are important, they do not directly address the psychosocial developmental needs of this age group. Distractor rationales. A. The first option. While physical therapy is important for joint function, it does not directly address the adolescent's psychosocial development. B. The second option. A high-calcium diet is beneficial for bone health, but does not specifically address the psychosocial aspects of adolescent development. D. The fourth option. Regular ophthalmologic exams are important for monitoring complications of reactive arthritis, but do not support developmental needs. Clinical tip. In adolescence, fostering social connections and peer interactions is vital for healthy psychosocial development, especially when managing chronic conditions. A 28-year-old client with borderline personality disorder is admitted to the psychiatric unit. The client has a history of impulsive behavior and self-harm. Which safety intervention should the nurse prioritize during the initial assessment? Here are the options. Option 1. Limit the client's interactions with other clients. Option 2. Conduct an environmental safety check for potential hazards. Option 3. Assign the client to a shared room with a calm peer. Option 4. Encourage the client to express feelings in a group setting. The correct answer is B. Rationale. Correct answer, the second option. Conduct an environmental safety check for potential hazards. Ensuring the environment is free of potential hazards is crucial for a client with borderline personality disorder due to their risk for self-harm. The nurse should assess the room for objects that could be used to inflict injury. This proactive measure addresses the immediate safety needs of the client, aligning with the principles of a safe and effective care environment. Distractor rationales. A. The first option. Limiting interactions might isolate the client and does not specifically address immediate safety concerns. C. The third option. Sharing a room may provide support, but it does not directly address environmental safety. D. The fourth option. While expressing feelings can be beneficial, it does not prioritize immediate safety precautions. Clinical tip. Perform regular environmental safety checks in psychiatric units to minimize risks of self-harm and ensure client safety. This includes checking for sharp objects, securing windows, and assessing for any other potential hazards. A 68-year-old client with chronic respiratory failure is admitted to the hospital for exacerbation of symptoms. The client expresses feelings of frustration and helplessness due to their dependence on supplemental oxygen and limited mobility. The client also mentions feeling isolated from family and friends. What is the most appropriate nursing intervention to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to participate in a pulmonary rehabilitation program. Option 2. Arrange for a family meeting to discuss the client's care plan. Option 3. Refer the client to a support group for individuals with chronic respiratory conditions. Option 4. Provide education on energy conservation techniques. The correct answer is C. Rationale. Correct answer, the third option. Referring the client to a support group for individuals with chronic respiratory conditions addresses the client's feelings of isolation and helplessness by providing social support and a sense of community. Support groups offer a platform for sharing experiences and coping strategies, which can improve mental health and emotional well-being. This intervention directly targets the client's expressed psychosocial needs, unlike the other options which focus more on physical health or family involvement. Distractor rationales. A. The first option. While pulmonary rehabilitation can improve physical health, it does not directly address the client's feelings of isolation and helplessness. B. The second option. Arranging a family meeting may help with care planning, but does not specifically address the client's need for peer support and social interaction. D. The fourth option. Education on energy conservation is beneficial for managing physical symptoms, but does not address the client's psychosocial concerns. Clinical tip. When addressing psychosocial needs, consider interventions that enhance social support and community connections, especially for clients with chronic conditions. A client in the ICU with a history of chronic renal failure and recent diltiazem, DRIT for rate control in atrial fibrillation, presents with hypomagnesemia, Mg2 plus 1.1 milligrams decimal, and multifocal PVCs. To safely manage this condition, the nurse should administer placeholder 1 of magnesium sulfate IV over placeholder 2. The correct answer is placeholder 1, 2 grams, placeholder 2, 2 hours. Rationale. Correct answer, 2 grams over 2 hours. Step-by-step clinical reasoning. 1. First, recognize that hypomagnesemia at 1.1 milligrams per deciliter is significant and can cause arrhythmias like PVCs, requiring magnesium repletion. 2. Consider the patient's renal failure, necessitating cautious magnesium administration to avoid hypermagnesemia. 3. Evidence-based practice suggests 2 grams of magnesium sulfate for moderate deficiency, infused slowly over 2 hours to prevent rapid serum level fluctuations and adverse effects such as hypotension. 4. Slow infusion minimizes risks associated with renal insufficiency, ensuring safe correction without exacerbating cardiac instability. 5. This approach aligns with safe and effective magnesium repletion guidelines in critically ill patients with renal impairment. Critical Care Nephrology Guidelines, 2023. Distractor rationales. Clinical tip. Clinical pearl. In renal failure, always opt for slower infusion rates for electrolyte replacement to minimize the risk of toxicity that ensure patient safety.
All right, that's it for today's question bank session. At the end of each practice, you'll receive your score along with detailed rationales and a full performance analysis. Be sure to check out ExamASAP, our AI-powered platform with over 5,000 peer-reviewed NCLEX questions and in-depth rationales. It also includes adaptive testing, audio rationales, daily updates, and 24/7 AI tutor support, all designed to help you pass the NCLEX on your first try. For the ultimate NCLEX content review, visit yournursingspace.com and explore our NCLEX Ultimate Guides and more. If you found this video helpful, don't forget to like, comment, and subscribe. It really supports the channel. Keep up the great work, and we'll see you in the next lecture.